Marley came in with one of the more common things that we've seen, particularly with our young folks post-COVID. She had some symptoms that were fairly concerning initially, was having some chest pain and heart was racing and acting irritated. We were able to get a cardiac MRI on her and confirm that there was no inflammation going on, which we have seen in a few kids. But she did have some significant dysregulation of her heart rate, where her heart rate normally in young healthy athletes like herself would tolerate lots of activity before picking up speed, and hers was really taking off racing with minimal activity and was really affecting both her performance and just overall quality of life. So with our COVID long haulers, we're seeing kind of a lot of clustering of fairly non-specific things all kind of coming together just to make people feel overall pretty lousy. A lot of fatigue and tiredness, a lot of just feeling like people could sleep all day long, really poor exercise tolerance, getting very short of breath with limited amounts of activity, and there may be a cardiac component to some of that with what we saw with this patient where we feel best when our heart rate response to activity has a nice smooth uprise to it, and it correlates with the degree of activity that we're exerting. And a lot of these guys, their heart rate just takes very little activity, starts racing very fast. So you essentially feel like you're exerting yourself maximally when you're doing fairly minimal things. So as time goes on, we're starting to be a little bit more precise and accurate in the amount of proportion of patients that are having complications related to COVID. As far as serious cardiac complications, things like myocardial inflammation or myocarditis, in our young, healthier population, that's somewhere just south of 3%. The majority of those, it's fairly minor. What this patient had is significantly more common. Putting an exact number on that, it's a little bit more difficult because a lot of people just end up not coming to their doctor for this, and people with more mild cases of it. COVID has a lot of fairly unique symptoms that we've seen, things like loss of taste and smell that you don't see quite as commonly. And I would chalk this up along those lines where there's other viral infections where people will have some autonomic dysfunction, we call it. And it's our autonomic nervous system that controls heart rate. And there's probably some tie-in between that and some other symptoms, but certainly with COVID, this autonomic dysfunction seems to be a lot more common. Certainly it's important to talk with your doctor if you have any symptoms that are concerning, and they can help guide you to more, emergent diagnosis and treatment if needed. Fortunately, in her case, this turned out to be something we control with medicines and not as dangerous. But in this situation where people are athletes and exerting themselves, and not just young athletes, but people who are older athletes at heart, like to exercise, you definitely want to get checked out if you have any symptoms that are concerning. So recovery time has been variable. Some of these folks with autonomic dysfunction, it can last, several months, up to 6 months I've seen so far. The vast majority of people, it's a month or two. Some people require medications to help slow the heart rate down, and some people do okay on their own. But her overall prognosis is excellent, as are most people's, and I can only say that because she was smart enough to come in and get checked out and was able to get all the proper testing done. I definitely recommend younger people getting the vaccine. I have 5 kids. 4 of my kids are old enough to get the vaccine. All 4 of them have been vaccinated. There's been some news recently about concern actually about myocarditis stemming from the vaccine, and that risk is exquisitely rare, much more rare than complications coming from COVID. So being aware of all of that, I still had all my kids get vaccinated, and I would recommend everybody else do the same. Yeah, I think now it's more important than ever with the timing for as many people to get vaccinated as possible. School's coming, in Lincoln, Huskers are coming, crowds are coming, and the higher the percentage of vaccinated people that we can get in our community, the less likely that we are to see another significant surge like they're seeing in other parts of the country with lower vaccination numbers.